The Liberal government's COVID-era vaccine injury support program was launched with promises of fair and timely aid, but it's been exposed as a scandal-ridden disaster, with shocking new numbers released weeks later than expected, only after mainstream media finally spotlighted its gross misconduct. As a betrayal of "we're all in this together" unravels, let's dig in. The vaccine injury support program called VISP was implemented in December of 2020 in response to waived from liability novel modified RNA products that were about to be rushed to market, then mandated for almost all Canadians indiscriminately. This program was supposed to serve as a lifeline for those injured by the safe and effective shots, promising fair and timely compensation, but it's devolved into an utter travesty. In my previous exclusive investigation into this program, which spans years of appeals and digs, I unearthed that the government assumed that vaccine reactions would be rare and believed that this program would only run for 5 fiscal years. The Public Health Agency of Canada, which is overseen by Health Canada, contracted a third-party firm, formerly called Raymond Shabbat Grant Thornton and now is Auxerro, to deliver the program, as it would have a real or perceived conflict. That was because the health agency was the same body that approved or authorized these vaccines for use in public, which, in my opinion, shows and admits that Health Canada and its subsidiaries are simply the procurement and distribution arms of Big Pharma. Now, as discussed in my October 2024 report on these exclusive government documents related to VISP, which, by the way, is months before global news apparently broke this story, Auxerro was already acknowledging that they were having difficulty managing financial support payments, forecasting operating costs, and in general, having trouble with the complex nature of injury support programs. They go on to admit that there's a massive discrepancy between what the Federal Treasury Board put in place for budgetary allowances and what the program actually needed in order to deliver this programming. But they also admit that the first 2 years of this program were focused on how to implement the program, and that assessment of claims only began in year 3. This proves a severe failure in planning and execution. The fact that critical claims were not assessed until 3 years in is a profound mismanagement of resources and priorities. Auxerro and the Public Health Agency of Canada knew this at least 2 years ago. Again, they reiterate in their December 2023 case study report that they were receiving a higher number of claims than anticipated, that they needed yearly amendments to the agreement, and that they were struggling to determine compensation amounts, especially for children, because children have no income to base compensation on. All of these discrepancies clearly indicate either a gross underestimation of potential adverse events, or, more likely, the lack of robust data on the safety profile of modified RNA vaccines at the time of the program's inception. This reflects a systemic failure to anticipate the real-world impact of rapidly deployed novel technologies like the modified RNA vaccines, which were ruled out under emergency use authorization without any established population-level long-term safety data. So where does VISP stand now? Well, their most recent stats show that they've received 3,317 claims, 352 of them are inadmissible, and 2,699 are with a mere 234 approved by the Medical Review Board. That's 7%. Only 7% of those who have applied to have received so-called fair and timely support, only that many have been approved so far. And the program has paid out over $18 million to these claimants, averaging $77,500 per claimant approved. But there are over 400 appeals, which suggests that many claimants feel their cases were unfairly denied or inadequately compensated, highlighting the ongoing issues with the program's ability to deliver on its promise of equitable and timely support for those seriously injured by vaccines. Flashback to that 2023 case study stat, there were 1,559 claims and a mere 103 approved at that time. By May of 2024, the number of claims received went up to 2,628. So while the VISP claims steadily rise, and so do the number of approved claimants, the difference between those who have applied and those who have been approved remains staggeringly low, underscoring a persistent failure to address the needs of thousands of Canadians who believe they or their loved ones have been harmed by mRNA vaccines, further eroding trust in a system that promised support, but instead delivered delays, denials, and inadequate compensation for the most vulnerable, especially children. So while Health Canada reported that serious adverse events following COVID-19 vaccination occurred at a rate of 0.01% of over 105,000 doses administered as of January 2024, the sheer number of adverse effects indicates harm that exceeds official estimates. According to a 2010 study by Harvard Pilgrim Healthcare, the number of adverse events following vaccination is severely underreported, with less than 1% of vaccine-related adverse events ever captured by official reporting channels. So Canadians, I think it's fair to ask, what are the real numbers of vaccine injury, and how many more families are suffering without recognition or support, left to navigate a system that seems more designed to protect institutional interests than to compensate those who succumbed to the safe and effective marketing mantra,
"We're all in this together."
Especially when that mantra came with mandates and social ostracization. For Rebel News, I'm Tamara Ugolini. If you'd like to see the market authorization for these shots revoked, you can sign our petition at nomoreshots.ca. There you can also support this kind of reporting and check out other reports for yourself. That's nomoreshots.ca.